In this video, we're going to be doing some hip mobilizations with movement. So you can do this for flexion, extension, abduction, and rotational movements. So to start with flexion, you'll have the belt as shown. You'll have one leg up on a chair or a stool or something that they can get themselves to a little bit of flexion. Now you want to kind of find a counterbalance for when you do this. So you can use hand to stabilize. You're giving a little bit of a posterior movement with your hips to provide that distraction. And then as they move into flexion, you're moving with the patient. So you want to make sure you're not pushing, pulling too hard. Make sure they feel stable as you're moving them. Okay. He brings his foot off of that and brings it to his other foot. You'll get yourself in the same position. And as he moves, you'll actually be getting that mobilizing hip into extension. So again, you may just have to kind of find what feels comfortable, making sure that they feel stable as you're going through the movements. For rotational, there's a couple different ways you can do this, one of which is using something that moves like a stool, and then you could basically have them move into internal, external rotation as you're using the belt. Then for the last one, for abduction, have them in a wide base of support and going to be here and moving towards the side as they move into abduction.